So now we're going to be tapping into back to sender because it's something that happens. And
It
there are some
does.
people that believe in it and there are some people that don't.
And those that don't strongly don't.
Exactly. Very judgmental
Yes.
bunch, that one.
Yeah.
But
Very.
anyway, I want to know from a nurse perspective, what does top actually mean
Okay.
in medical term?
Okay. So basically, top is termination of pregnancy, and that's basically like the expulsion of any attachment that would have happened inside a woman's uterus, which happens during or after fertilization. So basically, the two types of terminations of pregnancy, right? So we have the medical procedure and then we have the surgical procedure. So with the medical one, it's usually done from 10 to 12 weeks of pregnancy or anything sooner. So what they do is there are two types of pills that you become given. So the first one basically just stops the progression of the pregnancy, any hormones that become released, any attachments, anything like that. So it stops that process. So it can take about 24 hours or up to 48 hours up until they are ready to give you the second one. So the second one can be administered vaginally as a suppository. And that one basically now is responsible for expelling whatever that's inside. So with that one, that's when you start experiencing cramping. That's when you start now bleeding because everything that's inside is now coming out. And that's where people also experience like clots in their blood. And then there's the surgical one. So this one happens from 12 weeks to 14 weeks. So this is where they use a suction, right? So that suction is inserted inside your vaginal canal up to your uterus, and then it dilates your uterus and then kind of like suctions the contents that are inside. So remember, when a person falls pregnant, the attachment that happens, there's a lining that has to be created, for that environment. So all of that becomes expelled. So usually it's done under local anesthesia or general anesthesia, depending on the person's weight or their tolerance thereof, or whatever dose that they'd be given. So it depends on their tolerance. And then, yeah, to feel as less pain as possible because it is quite invasive. Doesn't take too long, 5 to 10 minutes. So that's why it's important for a person to really go the medical route so that they can be able to, collect the correct history, also know your allergies and know which route to take between the two procedures. A lot of people say that they go the underground route because they are afraid of judgment when getting to maybe like a public facility, for example, and you are maybe a 21-year-old, that's just obviously you're out there in life, you're doing your thing and you're in school, and a lot of healthcare practitioners have a certain attitude towards it, and some of them don't mind even voicing it when someone is seeking for help. So I think they just get afraid of that because already they feel guilty about it. They do feel like they did something wrong, hence they want to do something about it. But they just want it to be as quick and as swift as possible. But not knowing that there's extensive things that need to happen prior and even after. So I would advise, strongly advise and suggest that people go the medical route.
Okay, so I also heard, I don't know if this happens, going back to the suction part, right?
Yes.
I also heard that they take it out limb by limb. How does that happen? When does that happen? When you're having a top procedure, surgically, but they take out the limbs one by
One
one.
by one. So usually it happens when the fetus has already formed. So they do that, I think, because I've never experienced it myself, but I think they do that to just make sure that everything that's inside comes out, because whatever that would stay in there would rot. And then now you'd have extensive problems with your womb. So I think it's just for proper expulsion. I've never really experienced it personally, but I'm just thinking that's why they do it.
So I'm no longer gonna ask the scenario because she explained it. I'm just gonna decide this now.
About stage. Is it there
Pregnancy
point
stage.
where you can't do?
Yes, there is. So after 20 weeks.
you can't.
No.
It's child.
Yeah, at that
No,
point,
child.
at that point, there's a heartbeat. It's a person in there.
That's
So,
bro.
yeah, so it's not typically done after
Okay,
20
does
weeks.
this okay? Ish. I feel like now I'm going to be diving into like problematic ones. So you said 20 weeks, right? But there are exceptions if you go past the 20 weeks. For example, if you've been raped or the child is probably going to have problems growing up or has deformed or whatever, is that legal to have top
So,
in that?
legalities, I mean, I think it depends. I honestly think it depends. But what happens then now is that they induce early pregnancy. So they will give you some medication that will now cause you to be in labor and actually deliver the fetus. And then it just, obviously, because of lack of development, it doesn't make it. Yeah.
Okay, you mentioned on the medical part of, vaccination, that the symptoms after taking, I believe, the second pill is that you bleed a lot, even heavy clots. Does it happen sometimes that your body doesn't heal well, or during the process you just bleed more than usual? So any
Yes, it
unexpected
happens.
symptoms that someone should look out for?
Yes, you shouldn't be bleeding beyond, I think, a day or two. You shouldn't be experiencing heavy bleeding, especially. But then extensive tests are done after that, like extensive follow ups, just to check out for such things as even fever. You shouldn't be experiencing things like fever, because then that is also indicative that there's something that's maybe wrong, that shouldn't be happening. So you shouldn't be experiencing the process further than like 3 days, 2 days. No.
Do the patients come back though after like a checkup? Because me, I'm not gonna come back. See me once, never again.
That's real though.
No, I'm never coming back.
Real.
You have to come back. It's always advisable to come back so that we can keep a closer, look at your progress after that. Check your HB, make sure that everything is still fine, even your reproductive organs. We need to make sure that there's nothing that's out of the ordinary that's going on, because it is a risky procedure one way or another. So it is also important for follow-ups to be done as much as possible.
So we have an ask here.
Yes.
How many back to senders can a woman have before it's China?
Okay, so there's no medical research that has been conducted where there is a limit number of abortions, and it also does not affect your ability to have kids. The day you decide that, okay, now I'm actually going to, wait out the whole pregnancy, there's no limit.